Hey everybody, welcome back to my channel. My name's Nick Bankhead and I just finished my first year at the University of Utah School of Dentistry. So that means I am now officially a D2 student and I'll be starting my second year on August 18th, and I'm really excited to start moving forward in this journey. Today, I'm here to talk to you guys about the summer semester, give you a recap of what D1 summer looks like at the University of Utah, and give some insight to the different courses, the workloads, the sort of experiences you should expect in your summer semester as a first year student. So let's jump right into it. So the very first class I want to talk about is Perio 2 and Perio 2 Lab. Now, Perio 1, I'm not going to lie, was a harder class. We had that last semester, and we went into the nitty gritty, learning about all the different details, a lot of the etiology, and a lot of the biology behind periodontal disease. And this class, Perio 2, was less of that, learning more about treatments, phase 1 and phase 2 treatment of perio, and decodes, and different things like that. This class was definitely at a little bit slower of a pace than Perio 1 was. I know a lot of us appreciated that after coming out of the spring semester. In Perio 2 Lab, this was a great opportunity to get hands-on experience with doing oral hygiene things, learning the different curettes and scalers and things like that, and practicing scaling and root planing on our typodonts and with fake calculus. We had different practicals and different competencies that we had to do while working with the perio faculty and hygienists they bring in to help teach us these concepts. And in Perio 2 Lab is where we did our first full scaling and not root planing, but adult prophylaxis on a classmate. And so they have us work in groups of threes and do adult prophies on, I'll do it on my friend and he'll do it on the other friend and the other friend will do it on me. That way we work in a triangle and it's not two students working on each other directly. Also, it's a great opportunity to get some hands-on experience of being the provider in clinic, and I really enjoyed Perio 2 Lab. One of the more difficult things was the calculus removal practical that we had to do, and they put on this it looks like, I don't know, a nail polish, and it basically cements itself to the fake teeth, and we had to hand scale it all off of there and then we're graded on it. That was actually really, really tough, and I found that using hand instrumentation on a real patient was easier than the practical they gave us, which I appreciate, and it really helped us get us prepared for clinic. The next course is PATP, or Patient Assessment and Treatment Planning. This class was really fun. Once again, it was an opportunity for us to start to work as providers in the clinic. So we had to get competency for alginate impressions, pouring up a stone model, intraoral photos, extra and intraoral exams, as well as the famous stab lab that I'm sure a lot of you have heard of. That was quite the experience. Getting dental anesthesia or local anesthesia for the first time in my mouth was pretty crazy, and it was really fun. It took a little bit to get comfortable, but we all eventually got into the groove of things and enjoyed stabbing each other with needles, which was quite the experience, and definitely something I'll never forget. Our next course was dental anesthesiology. This course was online, and that made it really nice. We had quizzes and exams online, and learning about the biology as well as all the fundamentals of giving dental anesthesia or local anesthetic, the different anesthetics, the different, all the different facts about it that we had to memorize, which is fun. Now, I starred 2 courses here, Pathology 1 and Fixed Pros 1, and I'm gonna come back to those because those are some of the harder classes that we had this semester, and so that's why I started them. Our next course was Operative 3. Now, this was a continuation of Operative 1 and 2, where we're in the sim lab, drilling and filling. Now, this course didn't have any hands-on practicals till the very end. We did have tons of practice, fake patient assignments every single week. So we're still drilling and filling. They give us some fake patient and we have to present the patient to the provider, get approval, and then proceed with the treatment. So it was a good, once again, reps and good practice to get into clinic. And then at the very end, we had our competencies for amalgam and composite restorations, which were super fun. It was a little nerve-wracking doing class 2s and the different challenges we faced with that. One of the things I also liked about Operative 3 was the variety of cases they threw at us. they threw at us class 4s, chip teeth, veneers. Like, we did lots of different things in this course, and I felt like it really expanded our repertoire of especially composite restorations that we're going to be able to do in clinic. So really enjoyed operative. Next, we have summer clinic itself. Now, as a D1 student in your summer semester, you are still assisting your upperclassmen. One of the cool things is once you did get your local anesthesia certification and pass stab lab, I know a few of my classmates were administering local anesthesia for the upperclassmen on the patient in clinic, which was really cool, as well as you can do things like do sealants and polish and prophies and things like that. I didn't really hear about too much of the prophy sealings and those things, but definitely heard about a few local anesthesia experiences, which is super cool, great experience for them. We did go on rotations a few times, so they kind of like randomized the rotation. So I got to go into oral surgery. I was at an external clinic called Liberty, as well as in endo, helping assist. And it was really cool to see how the different external clinics and internal specialty clinics operate within the school. They all have a different workflow, and they all are led by like their own head person, which is really neat. The way you can network and meet some new doctors and get some more experiences working with other people. Next was the pathways engagement. Now, we're going to be applying to pathways at the end of this fall semester, and the pathways engagement was a way for us to start engaging in the pathway, whether that's shadowing, whether that's doing hands-on experiences, whether that's going to the pathway meetings. I did the pathway engagement for the perio pathway, the dental education pathway, as well as the oral radiology pathway. As someone who's looking forward and hoping to teach one day at a dental school after a career in private practice, the dental education pathway has you interviewing other professors, asking them why they decided to come and teach at a dental school and what brings them fulfillment and gratitude from that decision, as well as some of the challenges they may face while being a dental educator. The oral radiology pathway seemed really interesting to me because it allows students to get hands-on experience with 3D printing, implant guides, working a lot with a lot of the dental technology, and how to read panos, FMXs, and most importantly CBCTs at a way deeper level than we go into the class. So I really think that pathway is going to be really good for students that are interested in expanding their education in radiology. But the pathway I'm going to be applying to is the perio pathway. I had the opportunity to go and shadow a few of the periodontists that we have in clinic, and that was a really fun experience to get some hands-on learning from them, whether it's helping assist or help shadow or shadowing. And I had the opportunity to work with the pathway and shadow there, and I did realize that it is nice for them to have another person in the room. I can be they call it a gopher, hey, go for this, hey, go for that. But it's a term used for someone who goes and retrieves things, or say a student needs some eye protection, I'll run and go grab that for them. That way the student can focus on their patient and focus on delivering high quality care to them. Now, let's get into the two beasts of this semester. Pathology. Now, this is like oro and maxillofacial pathology. I think it was the official name of the class. But this course was tough, not because identifying pathology is hard, but just the way that our professor had us answer a lot of the questions. All of the questions were like type in, and as someone who's always kind of struggled with my spelling, man, it got me a few times, putting hyper instead of hypo or vice versa with different conditions. But yeah, pathology was a challenge, but we made it through. One of the highlights of that course was just going over all the different intra and extraoral lesions in the head and neck area. I think that once you get a little bit of that education, you start to notice it all the time. Like in clinic, some patients would come in with fissured tongue, with geographic tongue. I'm like, oh my goodness, that's so cool. Like, I now know what that looks like. So I really enjoyed pathology. The way that class worked is we had weekly quizzes and then a midterm and a final. And the midterm and final were both worth 40% respectively. And so you really have to put down and perform during those 2 days. Whereas the quizzes are worth 20% overall, and I think it was broken down into 8 quizzes. Next, we have Fixed Pros 1. Now, this course is notoriously probably the hardest course that I've heard about at the school, just because of the way things are graded and some of the questions you may get on midterm and final. It's very subjective, and some of the questions kind of come out of nowhere, so it really keeps you on your toes. Some advice I heard from an upperclassman when studying for the midterm was, you can study for 3 hours or you can study for 40 hours. You're going to get the same score. I put in so many hours in that first midterm, and then I realized exactly what they were talking about after the fact. This class is hard, man. Some of the questions are tough and really make you think, and you may not have learned much about those things or concepts before they test you on it. So highly recommend talking to upperclassmen on strategies how to pass this course. Obviously, what I would say is you show up every day and you practice really hard in sim for your practicals. And that gets into the next aspect of the course, the practicals themselves. Man, these are way more intense than the operative 1 and 2 practicals we had the previous semesters. We were doing crown preparations. We did one on, I think it was 4 and then 9. And yeah, it was tough. Little things like you nick the adjacent tooth, even if it's with a gingival margin tremor, man, that's -10. Like, that's a whole letter grade down. So you really got to be careful in Fixed Pros during your practicals to have all your dimensions as close to perfect. And perfect is determined by the grading sheet they give you. They give you all the dimensions. You try to get through your crown preparations, and you go from there. Overall, I thought this semester personally was harder than spring semester. I think it was harder for me just because of some of the spelling things in pathology and some of the tests in Fixed Pros. Other than that though, like Perio 2 lecture and lab I thought was like totally fair, and they really set you up for success. PATP similar, dental anesthesiology similar. Operative, the practicums or the practicals at the end, whatever you want to call them, they're very stressful, but because if you pass, then you're allowed to do those things in clinic starting your second year. So those can be a little stressful, but besides that, the class was very fair, pretty straightforward. And then clinic and pathways, basically you just show up and do what you need to do and you're good to go. Just some of my overall thoughts as a first year student getting in or having finished just my first semester or third semester of dental school, I would say at this point you're pretty burnt out. I know for me, I think I hit a little bit of burnout last semester, and we only had a 1 week break between spring and summer, and that kind of carried into summer a little bit. And so the biggest piece of advice I would give anyone is to work really hard and stay on top of the material. If you're playing catch up in any of these courses, dental school has too much volume. It's too difficult to get caught up. And as someone who was cramming a lot for the final in pathology, I can tell you I will not be doing that next semester in pathology too, and that staying on top of the material is the best way to go. Other thoughts are, man, it's summer out, it's nice. Try and find time outside of school to enjoy your life. I know it's so easy to get caught up in school, getting the grades, being in the classes, but I promise you, getting some time out there, spending time with your friends, family, is super important. So be sure to, even though you're in a summer semester, try and find time to take care of you and focus on your physical and mental well-being. Other than that, I had a great time this semester, and I am so excited to not be a first year student anymore and to be a second year student. And on August 18th, I will officially be a D2 student at the University of Utah School of Dentistry. If you like this video, click like, subscribe. If you want more, feel free to comment or reach out to me if you have any questions or want any insights and more details on the summer semester. And thanks so much for watching.